us in the studio, we have Dr. Korede Akindele, the Operations Officer, Dorcas Cancer Foundation, and Dr. Zubair Abdullahi, the Program Coordinator, Dorcas Cancer Foundation. Good morning and
all of a sudden you now made Korede a doctor.
Oh, sorry, Korede Akindele. I guess I got confused because of Dr. Zubair.
Good morning, gentlemen.
Good morning.
Good morning.
Good
Good morning, Nigeria.
Good morning.
Good morning. So let's dive into the topic childhood cancer. Just give us maybe a brief info of what childhood cancer is, what it entails, how it happens to kids, how do they get cancer, what happens, because I mean, if they grow up normally, what exactly is the cause of cancer in children?
Well, thank you for the question. Cancers generally happen when healthy cells lose their natural instinct to reach a particular point in time and then die off. So they become erratic and continue to grow and have the possibility of invading nearby cells. So in children, the cancers they have is quite different from cancers in adults because of the factors that lead to the development of the cancers. For adults, a large chunk of the cancers are responsible to choices they made perhaps some 10, 20 years before, which are the environmental factors based on their lifestyle choices. But in children, a bulk of the cancers are caused by unknown factors, secondly by genetic factors which are inherited from parents, and a small amount due to environmental factors which they are exposed to. So these cancers are very, very amenable to treatment, and then there's a high cure rate in advanced countries which makes them a lot more favorable than adult cancers.
So invariably, if I got you correctly, sometimes it's not about what the child did, it's just that you mentioned environmental factors, but couldn't it have been detected, maybe when the mother was pregnant or something?
Not exactly. The greater percentage of childhood cancers are undetectable during pregnancy. When the child suffers illnesses, which for quite a while, they are able to present to clinics and hospitals where doctors, after carrying a series of tests and investigations, can determine the particular cancer type. So it's not something they diagnose during pregnancy. The symptoms come into play during life. Some of these cancers have particular ages where they are most, when they come up the most, yes. So they are varied in their formation and in the type of cancers we have.
Oh, okay. So what should a family expect if their child has cancer? Say you go to the hospital for diagnosis and then they tell you your child has cancer. What are they supposed to expect? What are they supposed to do? How do you deal with your child having cancer? I mean, it's bad enough that the parents have to go through psychological traumas and all of that. But for the kids, how do you deal with that child? How do you, make the child understand that, okay, this is it, you're just ill? Because most times when we hear cancer, we just see it as a death sentence. How do we deal? How does the family deal with it? How do they make their child feel comfortable with such situations?
Well, in this kind of context, it would be very important to put the age of the child into the situation, because for children that are able to understand what the diagnosis is, it would be imperative to inform them of what is to be and what lies ahead for them. For the family in itself, cancer care has been discovered to be at least 10 times more expensive than any other treatment of childhood illnesses anywhere in the world. And as we all know, cancer care is actually very, very expensive in resource-rich settings, let alone in middle-income countries like Nigeria. So for the family, they should expect to spend a lot of money during care, and what would be very important for them to also note is that they have to find the particular center that has the right persons to take care of the cancer, which are oncologists, and the right tools and equipment in the hospital to be able to make diagnosis and further tests to be able to treat this cancer.
Okay, let me come to you now, Korede. Let's talk about, you work with a foundation, Dorcas Cancer Foundation. Basically, what you do is caring for people with cancer, children specifically.
Children, yes.
Okay, fine. Let's talk about the prevalence rate. In your opinion, do you think it's something that's becoming very alarming in Nigeria, judging by the work that you've done with people living with cancer?
Yes, thank you. It's becoming alarming because it's growing fast. The number is increasing fast. But so sadly that in Nigeria, we don't have the data yet to say, okay, these are the numbers, these are numbers of cases that we have seen. And in Dorcas Cancer Foundation, it's part of what we are doing so that we can have data and we can have, these are the common things we are seeing in children. So it's growing fast. And as a result of late presentation, people are not aware, and that is one of the things we are doing here today, so that people can be aware. Because one thing about childhood cancer is it can be survived if it is early detected. So what we will tell people is children has better prognosis. So when this cancer is detected early, they have a chance of survival. So it's growing fast. I mean, I've gone to different parts of the country in just my little time, and I've seen cases that, okay, this thing is real, the growth is alarming. But what we need to just do is to just keep telling people this is it and this is how it can be survived.
Okay, but looking at what you've said, the prognosis being very easy with children, I don't know if I agree or know much about that, because with adults, you can be able to talk about what your issues are when the symptoms present and all that.
Yes.
With children, now, how would you be able to identify, you're talking about early detection.
Yes.
How can we ensure that these detections are early enough? Because children, most of them might not be able to explain what is wrong with them.
Okay, I think the little I've seen, I mean, you know, it starts like normal sickness, like someone said, I have malaria, okay, this child has typhoid. So what we advise people to do is, parents needs to pay attention to their children's health. It's very important to take your child for medical checkup so that you can be sure of what is going on. Now, there are symptoms and signs of cancer in children. I mean, it's not like an adult. There is no screening center for child cancer. Not like an adult whereby, okay, this is a cervical cancer screening, this is a breast cancer screening. But children does not. What is in children, there are symptoms about it, something that prominent and something.
Okay, can you tell us some of the symptoms?
Okay, some of the symptoms, for example, we can say for leukemia, we can say, okay, sometimes after infections, constant infections, this child is having constant infections, and okay, it's going in and out of hospital, falling sick today, getting better tomorrow. Okay, this child is looking pale. Okay, at the eye, there is lots of sight, or lots of vision in the eyes. Okay, and you notice maybe a growth in any part of the body of the child, or your child is complains of continuous pain in the bone. I mean, you're trying to breathe for your child in the morning, and while you're pressing, and the guy is just, so you need to just do a second check. Sometimes these symptoms might not say, okay, this child has cancer, but what I advise and what we talk about very well in Dorcas Foundation is do a second check. Be very sure that, okay, this is not, and Dr. Zuberi can shed more light.
Okay, before we come to Dr. Zuberi, we're getting signals from Abuja, and let's make welcome Dr. Emeka Moma, a medical practitioner. Now, doctor, let us talk about childhood cancer vis-a-vis the realities in Nigeria. You know, cancers are really very hard to manage. What is the reality for most parents in Nigeria when their children present with cancer, you know, at the hospitals? Do we have the equipment, and do we have all the facilities readily available to manage cancer for children here in Nigeria? What's your opinion?
You hit the nail right on the head. Pediatric cancers actually are a reality in our environment. These are diagnosable conditions. I can name several, but the most common we see within our environment are either blood-related, brain-related, kidney-related, and then the infectious type of cancers that can emanate over time. To answer your question, because of lack of access and underdiagnosing, a lot of children, usually between the age of 0 and 4, will die from a cancer-related condition, but often underdiagnosed or not even diagnosable at all. I did mention there are genetic and also infectious type of cancers, and within our environment, there's just a lack of access to subspecialty care and early diagnosis. Where these children can be diagnosed early and be given the available help, but the mortality rate within the African population is extremely poor. We have just by statistics, within the African American population, we have a rate of 1.4 per thousand children that develop a form of cancer. Within our African population, we have between 1.7 and 4 per thousand. So it's a reality, and it's here, but it's just often underdiagnosed because of the situation of our healthcare structure in Nigeria and Africa at large.
Okay, Dr. Emeka, I have a question now on the treatments for children. What are like the treatment? Can you tell us some of the treatment plans for children who have cancer and what the side effects are? And if those side effects, do they have any repercussions in future? And some of the diseases your children are supposed to stay away from. So if your child has cancer, how careful do you have to be? Does he having malaria or typhoid, does he add more? Does it add more? Does it cause issues? Is he supposed to take an immunization or something against some certain diseases? These are the questions I want to ask.
Okay, thank you very much. I'll take the first part, which is that again, childhood cancer is a real condition. There's poor access and diagnosis of this within the environment we find ourselves. Do other conditions compound a child who has childhood cancer? Absolutely. Those are some of the struggles we do face in healthcare in Nigeria, which is that we often diagnose or misdiagnose or chasing the infectious and actually forget the more chronic condition. So are there infectious causes of cancer? Absolutely. There are virus causes of cancers, but we're never talking about that yet. We're still within the phase of dealing with the endemics of malaria and conditions such as typhoid. So we do, in the nutshell, we have a long way to go in terms of restructuring our healthcare facility, access to primary healthcare, so that we have the bigger tertiary systems, tertiary care structures be available to deal with such conditions like cancer, which do not exist as we speak. So to answer your question more directly, yes, this will have an impediment on the survival of a child who has been diagnosed with childhood cancer. But again, I put it to us saying that we haven't got to the stage where we are diagnosing enough of these cancers in children at all. Most of these children are labeled of either having died of malaria or typhoid or some other condition. So we have a long way to go with childhood cancer in Nigeria and Africa at large.
Moma, we won't take much of your time anymore. We want to say a very big thank you to you to discuss on this issue of childhood cancer. Dr. Emeka Moma joined us live from Abuja, and we do appreciate it. All right, we'll be going to Ibadan in the course of the show, but just a reminder, viewers, that if you have questions or if you have comments, feel free to do so. Send us an SMS. The number will be displayed shortly on air. You can also interact with us on our social media platforms using the hashtag Galaxy Today. Let's talk to the Dorcas and Cancer Foundation reps now. Looking at cancers, most times what comes to mind when it comes to treatment and management, people talk about going through chemotherapy and all of that. Do the children also have to go through the same procedures, doctor?
Absolutely. The three main treatment modalities for cancer in adults and children alike is surgery, for the ones that are resectable, that are able to be removed surgically.
When you say resectable, removed surgically, what kind of cancer specifically do you mean?
For example, we have nephroblastoma, which is Wilms tumor. It is the cancer of the kidney. There might be cases where the tumor, which is the solid body of cancer cells, can be removed by surgery. Okay. And then in this case, it is one of the treatment modalities that is taken. Yeah. Furthermore, children also undergo chemotherapy, which can also be a form to use to treat the cancer. Okay. A third option would be radiation therapy, also called radiotherapy, and in some aspects, all three can be combined to get effective results.
Wow. Whoa. So what could be the effects of? I mean, adults complain of some effects of chemotherapy on them. How does it affect the child? Say, for instance, a child who is 7, 10, does it affect the brains? Does it make them susceptible to other kinds of, abnormalities while growing up?
Yeah, to answer the second question first, chemotherapy has accompanying side effects, which is present in adult and children alike. But for childhood cancers, the long-term side effects are beginning to come into play because these children will become adults someday. In the future, there have been cases of fertility issues with growth retardation, with persistent infections due to the chemotherapy exposure they had when they were kids. So chemotherapy and other forms of cancer treatment can cause immediate and long-term side effects.
So is there any way to mitigate this side effects?
Yes, that's what they do in oncology centers, which are absent in this environment we find ourselves in. But in other countries, there are specialized centers where people can go to, yes.
Okay, Korede, let's talk to you now. Looking at cancer in Nigeria, I don't know, how do you manage, I'm talking about support now, not just for the child, also for the parents, because it could be very, very, cumbersome, managing children, specifically when they now have cancer. Do they have to get treatment at the home, or do they have to be confined to a hospital or a hospice or something? How is it really done?
Okay, for us, the Dorcas Cancer Foundation, we work with teaching hospitals, major teaching hospitals in Nigeria. And so that's where we treat our children from. I don't advise anybody to treat it at home, and it has to be treated by a pediatric oncologist, and not just any pediatrician, a pediatric oncologist, someone that knows this thing. So that's where we come up. What we do at the Dorcas Foundation is to just support your treatment, from testing to treatment to surgery to everything about the child's treatment, even admission. So that's what we do at the Dorcas Cancer Foundation. And we do, because we get our children from teaching hospitals. Here in Lagos, we're working like 2 hospitals in Lagos, teaching hospitals in Lagos, and some other teaching hospitals across the country. So that's what we do at Dorcas Cancer Foundation. So it should be treated in an hospital, a government hospital, a tertiary hospital that has pediatric oncology in there. So that's where it should be done. That's what we are doing. And for the parents, because like I said, we used to say, when a child has cancer, the whole family has cancer, and it's a great emotional psychology for the parents. So at the Dorcas Cancer Foundation, we create a forum we call the support group meeting, so as to support these parents emotionally. It's a support group meeting. We hold it monthly for them. We bring them together. We bring a counselor to speak with them. We bring an emotional therapist to talk to them and tell them, okay, this thing you're going through, calm down, support your child, this is how it goes. And it's working. It's working because in that forum, they have chances to tell us their burden, they pour out their minds, what they are going through, and we bring in experts that provide emotional psychology to them.
All right.
All right. So,
with some teaching hospitals and here in Lagos and beyond, but then again, so far, what have you been able to do, to make sure that these children, they don't just die? Your foundation, that is, what have you done specifically as regards some support and financial outlay, to just reduce the burden on some of these indigent patients?
Okay, thank you. At Dorcas Cancer Foundation, when we pick a child, we sign up the child. That's what we do. We take the child treatment, completely the treatment, the blood transfusion, like I said, the testings, the treatments, the chemotherapy drugs, even the surgery, the radiation. So what we do, we take the burden completely away from the parents, and the Dorcas Cancer Foundation takes care of all through the patient. We've been dealing with, we have over 30 children we are working with, and we also have over 5 on our waiting list. You understand? The ones we are working with directly, they are over 30, and we have some on the waiting list due to financial constraints. We've not been able to extend to them. But at the Dorcas Cancer Foundation, when we pick up a child, everything about the child is taken care of.
All right, my question is for Dr. Dubar. For kids who have cancer and have survived, how often do they need to go for tests to make sure that nothing comes back or they don't have another form of cancer?
All right, for kids that have already survived the initial cancer, there is a chance also from research that a second cancer can arise from some of the treatment modalities.
Wow.
Also, the cancers are specific in their checkup rate and frequency. So for each particular cancer, there is a different time interval that is needed for checkup.
So the child will continue going for tests on a regular basis?
Yes.
You don't stop going?
You will at some point. For initially, the frequency of tests, of follow-ups may be very high. Could be as early as 6 weeks, could be as early as 2 months, could be as early as 3 months. But later on, it extends to a yearly visit and some subsequently every 5 years.
Okay, the question for you, one of our viewers says, good morning, doctor. How do we guard against childhood cancer from happening?
Well, like I mentioned earlier in the show, guiding or preventing childhood cancers is not something we can actively do because of the factors that cause childhood cancers have not been thoroughly identified due to a lack of adequate research. Also because the other causes that have been fingered include genetic factors, which you cannot actively prevent against. Okay. We hope that in the future this would be something possible.
Okay, for children who might be prone to getting cancer, you talked about genetics and all of that, you know. I know for adults, they can actually prevent this. A popular star, Angelina Jolie, had to do a mastectomy, double mastectomy, just to prevent breast cancer. For children, what exactly can they do?
Well, the example you gave is that of some form of cancer whose risk factor, the particular cause, has already been identified. So yes. So because the particular factor, the main causative reason, the main reason why this happens has been identified, she was able to forestall the development of the cancer. But for childhood cancers, as I said, it looks like every other illness until it begins to look more like cancer. So it's not something you can actively look out for. But we advise parents to always monitor their kids.
Just pay attention, basically, to everything.
Everything about
Yes. Paying attention, let's get some tips now because we're almost out of time on this segment. Let's talk about tips that that parents should be watching out for, or should be doing, you know, so that they can present early, just in case their children might have these cancers.
Well, if you notice that your child, who was previously very active, suddenly becomes drawn in and less active, is losing weight, is easily fatigued, has a lump on any part of the body, is bruising easily from physical play, and also has fever, which will not go away. After presenting at any nearby hospital, and the reason for consultation has not been met, the illness has not gone away. So it's at that point it's imperative to take a second opinion from preferably a higher center, which would be a tertiary center in this environment.
So our regular clinics, our regular hospitals, can they diagnose that, oh, this is more than just malaria, or this is more than just typhoid?
Well, they could. In this case, they can be able to tell you.
But they might not say this is cancer. They might just say, okay, this is not malaria, this is not typhoid. Okay, maybe suggest.
Like an example that we've seen, I mean, when we interact with the parents, I mean, you know, some of them have to go to an hospital before they refer. I mean, most times, the doctors, they miss that. Some will see signs like, okay,
not exactly.
This thing that I'm seeing, why don't you, they do a referral.
Most times.
Referral most times, like, okay, some of them will say, okay, this thing I'm saying, I'm not too sure. Why don't you just go to a bigger hospital?
To clarify what he said, in Nigeria, the referral system works from a lower center to a higher center. The higher centers are so-called higher because they have the right persons and the right equipment to diagnose accurately and also to administer treatment. So for most of the nearby hospitals, they are unable, due to the financial implications, to bring the right equipment in to the country to be able to make the accurate diagnosis. Also, they are unable to provide the actual personnel, the actual specialists needed to do all of this.